I'm Dr. Robert Perkins, Professor of Applied Psychophysiology with the College of Certified Psychophysiologists. I'm here today to talk about the efficacy rates of PTSD treatment by the U.S. Department of Veteran Affairs. Now, military suicide is a very real issue within our society. PTSD has been the catalyst of many veteran suicides, which has recorded approximately 22 veterans a day taking their own lives. And PTSD has been that catalyst of many of those people that took their own lives as a result of feeling overwhelmed and no solution in sight for the daily physical, emotional, and psychological symptoms that plague them as a result of combat deployment. Now, the U.S. Department of Veteran Affairs takes this issue very seriously and has expanded its resources in addressing PTSD through various means, including trauma-based psychotherapy, which includes evidence-based psychotherapy and cognitive reprocessing therapy, as well as using technologies such as EDMR, which is eye movement desensitization reprocessing, and through the use of pharmaceutical medication, sometimes a combination of all three. But how effective have they been in reducing veteran suicide and the successful treatment of PTSD? The word efficacy is used to describe the rate of success in a percentage rate of how treatments are evaluated and measured. Okay, so according to the VA, 7 out of every 100 soldiers will develop PTSD versus 6 out of every 100 civilians will develop PTSD. Now, of course, those numbers do not reflect any number of soldiers who may have died and had PTSD. And other studies have shown that figures more recently to be between 11 and 20% of soldiers that develop PTSD. But much of the focus of the VA in terms of mental health provision is addressing the treatment of PTSD. Now, in a study from 2019, which addressed specifically factors associated with PTSD therapy, specifically the completion of EBP, which is evidence-based psychotherapy, a study showed that over a 15-year period, where 265,566 veterans with PTSD were studied, that first of all, only 22.8 initiated treatment for their PTSD. And out of that number, these are the people that started treatment, only 9.1% actually completed the treatment. Now, the VA touts high efficacy rates for PTSD on their website, stating that psychotherapy success rate for PTSD is 53%, EDMR success rate is 53%, and pharmaceutical treatment alone success is 43%. And these are regarded as high efficacy or high success rates. Well, first of all, how can an efficacy rate that is barely 50-50, I mean, only 3% over half, be deemed as successful? That translates into basically, for as many people that it works for, almost the same percentage it doesn't work for. And that really doesn't take into consideration an important statistic that can also be found on their website, which is that 9% of people that have PTSD who seek no treatment whatsoever will no longer have PTSD after 3 months. So the whole fact that in treating PTSD with psychotherapy and EDMR doesn't work for 47% of people, and using pharmaceuticals for treatment doesn't work for 50% of people, this is not acceptable. How is 50-50 an acceptable efficacy rate? But that is the standard of high efficacy, both in mental health treatments as well as with the treatment of physical diseases as well. But since we know in traditional psychiatric and mental health diagnostics, there's zero biological, biochemical, or radiological markers to identify that PTSD exists. So my question is, how is success measured that PTSD is no longer present, as it cannot be compared to biological, biochemical, or radiological data taken prior to the treatment? Is it that all of the physical, emotional, and psychological symptoms are now non-existent, and that person has resumed optimal performance and quality of life that was present before the PTSD occurred? Absolutely not. Success is measured by only a reduction in the intensity level of the system. So, if you indicated on your PTSD questionnaire prior to treatment that your anxiety level was, say, 10 out of 10, And after 3 months, you've indicated that it's now 7 out of 10. So it's still present. It's still fairly high. If you put 7 out of 10, boom, that is successful treatment of PTSD. It doesn't occur anymore, and it's recorded as a win column. That is not a win to me, nor do I believe that that is successfully treating PTSD. Having the individual restored to optimal functioning, both in their personal and professional life, and either eliminating the symptoms or a reduction in intensity to at least 2 or 3%, I believe equates the successful treatment of PTSD. Now, in medical school, in order to graduate and to be a physician, a student must obtain a minimum of a 3.7 GPA in order to graduate. And that's around 90 to 93% in order to graduate and practice medicine. How is it then we allow mental health bar of success to be 50% in order to be classified as high efficacy? So when people criticize alternative PTSD treatment practices or activities that promote the general well-being of the individual, that don't follow the traditional established methods or modalities, just know that they are trying to help that 47% of people to whom psychotherapy and EDMR doesn't work on, and that 57% of people that pharmaceuticals don't work on. Alternative methods don't accept 50-50 stats, 50-50 efficacy rates as being successful, nor do they accept 22 veterans a day taking their own lives.